Most people, when we talk about dental problems, think of caries or cavities. But another type of tooth damage is acid erosion. Erosion is very common in the general population, and it's likely especially relevant for patients who undergo bariatric surgery. Because the operation ahead of you will change how you eat and how you drink, and this may create a problem for your teeth. Tooth enamel is the outer layer of the crown, the visible part of the tooth. Underneath is a tooth structure, the dentin, a bone-like tissue, which is much softer and more vulnerable. Enamel is actually the hardest material in the human body. If it weren't so hard, you'd literally chew your teeth to pieces. The enamel takes a hit from both physical wear, like chewing and grinding, and chemical wear by acids. We don't grow new enamel, so you need to protect the enamel you already have. Acid erosion is, simply put, loss of tooth substance. Your tooth structure dissolves. Enamel isn't replaced, so you can't reverse this process. Hence, your goal should be to slow it down as much as possible. Even though enamel is hard, it's not always at full strength. After you eat or drink, the pH in your mouth drops. And when the oral cavity gets acidic, minerals leach out of the enamel. That makes it more porous and more vulnerable. The good news, once saliva gets to work, the acidity is neutralized, and saliva also brings minerals back so the enamel can re-harden. So the enamel cycles between rock hard and vulnerable several times a day. Totally normal. And as long as there's a balance between those phases, your enamel can last for a lifetime. To show how hard enamel can be, at neutral pH, it can be as scratch-resistant as steel. But if you're sipping cola or energy drinks, which are among the most acidic things many of us consume, enamel turns temporarily porous, about as easy to scratch as chalk. If you have normal saliva flow and also add long enough breaks between eating and drinking, you will be well protected. Add some fluoride and you strengthen the enamel even more. Look at this chart, showing the link between meals and mouth acidity. pH often drops sharply after eating. You're in the red zone. The enamel loses minerals, and we refer to this process as demineralization. The saliva usually buffers pH back up. And not just that, it delivers fresh minerals, phosphate and calcium, and you return back to the green zone, where your enamel gets remineralized. This balance can be harder to maintain after surgery. After a gastric bypass, your stomach is the size of half an egg, and after a sleeve gastrectomy, it's still small. Imagine a small cup of yogurt. So, at the bariatric clinic, you'll be advised to increase meal frequency, often 6-7 small meals a day, and to drink well before or well after meals. Among us, obesity clinicians, the perspective is to prioritize nutrition now that your stomach volume is so small. When meals are that close together, and especially if what you drink is acidic, you can spend more time stuck in the red zone, where enamel struggles. If you also develop dry mouth, things get worse. Your ability to neutralize pH drops, and your teeth face more acid more often. So yes, you are facing a dilemma. We in the bariatric clinic emphasize frequent meals for optimal nutrient absorption. Your dentist, on the other hand, may say the opposite: eat only a few meals to protect your enamel. And you know what? Everyone is right in their own way, so now it's time for some smart choices. The solution is to build good oral hygiene habits and smart drinking habits. Do that and you can largely prevent problems. And let's talk about drinking, because that's where the biggest prevention win is. Drink smart, not sour. If it's tap water, it's pH neutral, no problem. Plain water should be your first choice. But many patients drink more cola drinks and energy drinks in the day than they consume water. I've met plenty of patients who say they're addicted to these things. And they often drink with a clear conscience. Sugar-free means no calories, and our focus in the obesity clinic has been on the weight, not their teeth. Cola and energy drinks are real bad guys. They contain phosphoric acid, which is a very strong acid, meaning very low pH. Fruit juice is also acidic. Although they contain natural acids, they are not kinder to the teeth. Saliva still has to work hard. Quantity-wise, juice is probably a smaller issue for our patients than energy drinks, sodas, and bottled water. Yes, you heard that right. Flavored bottled water. If something is with flavor, it likely contains citric acid. Citric acid is also potent and can drag the pH down to around orange juice levels. Even if it's not as low as cola, it's still a troublemaker. Citric acid has this additional bad quality of chemically binding to the enamel, which gives the acid extra time to pull calcium out while blocking new calcium from reattaching. You cannot taste how much citric acid is in there. Manufacturers mask the sourness with sweeteners and other flavors. And while it's easy to see if a drink is sugar-free, it's impossible to tell how acidic it is just by reading the label. But you will find it there. Citric acid should be listed by its name or by its E number. As a clinician, I see the irony here. Many patients drink bottled water with a clear conscience because it's sugar-free, and because we in the bariatric clinic have focused on cutting calories. And if it's non-carbonated, many assume it's okay for the teeth too. But carbonation itself is not a big problem. Carbonic acid, which is CO2 dissolved in water, is a very weak acid. It only nudges the pH a little. So if adding bubbles helps you enjoy tap water, that's not a big deal for your teeth. It's still much better than flat, flavored bottled water. If you sip flavored bottled water all day, the citric acid can cause severe erosions, and symptoms are tooth sensitivity. And the areas that get the most acid, like the front teeth when bottle sipping, can develop visibly thinner enamel and look more translucent. Overall, the tooth gets weaker. And my hypothesis is that this is an important reason behind something many post-bariatric patients report: small pieces of tooth breaking off. Now, I know it can sound a bit preachy to say just drink tap water, which we can do in Norway where the tap water is mostly excellent, because there's a huge commercial pressure to make us lifelong consumers of soda and energy drinks, and I love sodas myself. So my message is, bottled water, soda, juice and energy drinks don't have to become a problem for your teeth if the volume is limited. Like most things in life, the dose drives the response. And there's a smart way to drink sour stuff. It's the sipping that does the most damage. When you bathe your teeth in acid for long stretches, saliva can't keep up. When sipping, you stay in the zone where minerals leach out of the enamel for hours, and the fix? Take breaks, ideally as long as you can. By all means, have a glass, but just drink it and be done. Then, assuming you don't struggle with dry mouth, saliva will buffer the pH back in reasonable time. And if you want to drink acidic beverages even smarter, finish it in a relatively short window, then take a few sips of water. That helps neutralize pH much faster than saliva alone. So, to sum up, surgery will push you toward a different eating and drinking pattern that can make enamel more vulnerable to acid erosion. But you do have the power to counter this with proper oral hygiene routines and smart drinking choices.